Good morning, everyone. Good morning, everyone. Welcome to another edition of our bi-monthly webinar session. Right now, we have just 24 participants. So I'd like to crave everyone's indulgence for like 3-5 minutes so that we can allow more people to join. We thank you for your patience. Thank you. So we'll be back in like 5-7 minutes. But before I leave, I would like to acknowledge the presence of the 18th head of service, Mrs. Shade Jaji. Good morning, Ma. We thank you for always logging in to our session. Thank you, Ma. So we'll be back in like 3-5 minutes, please. Thank you. Good morning once again. My name is Bisi Roland from Post Service Department, Public Service Office. I welcome you once again to today's webinar session. And our topic for today is Gingival Recession. It's a delight to have you here as we talk about today's important topic as it affects our oral hygiene. But before we start, I would like to invite the Director of Post Service Department, Mrs. Durodola Olushola Bukola, to declare the session open. Over to you, ma'am.
Good morning, distinguished participants on this call. I would like to specially recognize all members of Alausa on the call, particularly the 18th head of service and the immediate past secretary to the state government, Mrs. Fola Shade Jaji. We are delighted to have you on this call this morning. As you have been told, our topic today is gingival recession. It's a dental condition and it could be age-related. We have a lot to learn this morning to ensure that we have perfect dental condition even at old age. You know, in our culture, there is a prayer we say, Afi owo pa owu afi erigi jobi. And I keep telling myself, is that something that must happen? That we must ferigi jobi? Do we have to lose all our teeth and then begin to use gum to chew? We will hear all of that from Facilitator this morning. So I want to advise us, let's grab our jotters, ready to take notes that we are going to constantly refer to. Once again, I want to welcome us and I want to extend the warm regard of the head of service and the permanent secretary public service office. They are both unavoidably absent this morning. They had to attend to some important state events. Once again, I want to welcome each and every one of us to this call. And I wish us happy deliberation. Thank you. On that note, I want to declare this webinar open.
Thank you, ma'am. Our facilitator for today is a dental doctor. His name is Dr. Idubor Ezekiel. He's very passionate about preventive health care. He graduated with a bachelor's degree in dental surgery from the University of Benin, Benin City, Edo State. He has worked in the University of Benin Teaching Hospital, and he currently works with the Lagos State Ministry of Health. Like I said, he's passionate about dental health care, and with primary regards to preventive measures to ensure safeguarding oral health. His hobbies include reading books, watching movies, and listening to music. Dr. Idubor, you are welcome to our session, and we appreciate your presence. So would you please unmute yourself so that we can start?
Okay, thank you. Good morning, everyone. I'm very happy to be here today with you guys. So, as she just said, our topic being gingival recession, it might seem like a very complex or complicated statement, like, what's gingival, what's recession? But it's a very common thing. It's what we see every day. I don't think there's anyone amongst us that has not seen it, but we might not know what we are looking at. So basically, gingiva is about the gum. Gingiva is the gum. So recession, we are talking about the gum pushing backward or pushing forward, basically movements of the gum. So gingiva is the gum, recession is something going down. So the gum going down, the gum wearing off, like that. So we'll be working with our outline. The outline is definition, we define some terms, so it will be easy for everyone to understand, for everyone to follow us. Then we'll talk about classifications, talk about the causes. This gingival recession, this gum wearing, what causes it? Then talk about the significance, basically talking about if someone has this issue, what is the implication? What will it result in for this person? Also, very important to talk about prevention. How do I prevent this thing from happening in the first place? And then subsequently, in case I have this thing, I checked my mouth, I looked at the mirror and I can see that it's like I have this thing that this doctor talked about. So we can now focus on treatment, on how do we manage it for those of us that already have this condition. So to make the lecture very easy for everyone to understand, so both who is a dentist, who is not a dentist, who doesn't know anything about it today should be able to follow us from the onset of the lecture till the end. So to make things easier, we have this picture. This picture is basically a picture of our teeth in its natural environment. So some of us might remember from our biology days that the tooth is divided into two parts, basically. There's the crown and there's the root. The crown is the one that you can see. If I open my mouth and I'm smiling, the part of my teeth that you can see is the crown. Then the part that you cannot see, that is buried inside, is the root. So that's to make things a lot easier. And looking at this picture, there's something else that I would want us to take a look at. We mentioned gingival recession, and I said gingival recession is gum recession, basically. So we can see gum on our screen there. So there's the crown, the whitish part that we can see, the top. There's the gum noted there, and there's the root buried inside. So looking at this picture, you can already tell that the gum is between the crown and the root. So the gum is basically dividing the tooth into up and down. So there's a gum at the middle, and there's a gum at the middle, and there's a crown, and then the subsequent roots. So we can move on to the next slide. Okay. Yes. Okay. Looking at this, to make things easier, to make things simplified, to start with, we are talking about gingival recession. Okay. Before we talk about gingival recession, let's talk about what a gingiva is. I already mentioned that gingiva is gum. So going up to slide 4. Okay. The gingiva, also known as gum, is the pink colored, basically looking at it in most mouth is pink colored, although sometimes it can look a bit reddish. But in most mouths, it's pink colored and it surrounds the teeth. And the main function of the gum is to protect the tooth. So that root that is buried inside, the gum is covering it to protect it. So the root is not exposed. Okay, so moving on to the next slide. Okay, so now what is gingival recession? I already mentioned that for each tooth, there is the root, there is the crown. So basically, this thing is straightforward. When the gum seems as if it's peeling off, it's like the gum is shifting towards the root. That is gingival recession. So looking at this picture that I included, as you can see, the gum is shifted upwards. It's supposed to be at the middle, but it shifted upwards. So basically, this is gingival recession. The yellowish parts that we can see, looking at the teeth, we have a part that is like kind of whitish, and we have a part at the top part that is like brownish or yellowish color. That yellowish color is the part that has been exposed. That place is the root. So in this picture, we have teeth and we have gums, but the gum has peeled off. The gum has weared off. So the roots, part of the roots are now exposed. And next slide. So initially in our outline, we mentioned that we'll talk about classification. To make this lecture a lot easier, we'll focus on just this type of classification, which is also very important. The classification says that gingival recession is grouped into localized and generalized. Localized in any setting basically means that it's happening in only one place. Generalized means it's happening in multiple places at the same time. So looking at this picture, we can see just one tooth here. The gum is weared off. So it's like, this particular tooth is not looking like the way the others are looking. For the others, the gum is at the middle of the crown and the roots. But for this middle one, the gum is down. The gum is below the crown, down below the crown. Like the gum is basically the gum is eating towards the root. That's for localized, but it's only happening in one place, one tooth only. So this is localized gum recession. Next slide, please. Okay. Unlike the other picture that we just saw, in this picture, we have multiple teeth that are being affected. All the teeth that we can see at this upper level, you can see that the gum has been pushed upwards. So we now have yellowish a part of the tooth that is exposed. This yellowish part is not supposed to be exposed. Normally, it's supposed to be covered by the gum. But now, in this person, we have multiple teeth, basically all the upper teeth that are now exposed because of gingival recession. So, next slide. Subsequently, in the coming slides, we'll talk about this thing. So we know that, okay, gingival recession is when the gum is peeling off. And we have said that it can happen in two ways. It can happen to just one tooth in one person, or it can happen to multiple teeth in the same person. So it can be like, it's only one of my teeth that is affected, or I have many teeth in my mouth that are affected by this thing. So we move on to causes. If we don't know what is causing a condition, we will not know how to prevent it. We will not even know how to how am I going to ensure that this thing does not happen to me? Or how am I going to ensure that this thing that is already happening to me does not get worse? So we need to know the causes and we need to understand it very well.
We're sorry. I don't know what happened. I think it's from his end, but we can't hear him. So I would like to get in touch with him.
Okay. Sorry for the breaking transmission. So we'll focus now on the causes. As I was saying, brushing is not enough. You have to brush well and you have to brush for a reasonable amount of time. Brushing for 20 minutes is too much. 5 minutes is very much ideal for brushing. So sometimes some people feel, oh, maybe I don't like the way my mouth is smelling, or I don't like, it's like I have some deposits on my teeth, that my teeth has stains. So let me brush for a long duration of time so that I'll be able to remove those stains. If you notice that, I have deposits on my teeth and I've had this thing for years, it's better to come to a dental clinic, go to any dental clinic and see a dentist instead of going towards the route of let me brush very well so that this thing will leave. Because brushing very well as it like would in turn cause issues. I included this picture. This picture I included is a condition in dentistry that we call abrasion. So abrasion usually occurs when someone has brushed wrongly for a long duration of time. So instead of brushing for 5 minutes, you are brushing for 20 minutes, you are brushing for 30 minutes. It can result to something like this that I just pictured. Another thing that can cause gingival recession, because you are brushing for a long duration of time. You understand? Brushing for a long duration of time will in turn cause your gum to wear off. Because your brush is hard, your toothpaste is hard, you are brushing, it's peeling off your gum. You understand? So slide 8, please. Slide 8, please. Okay. So looking at this picture, I mentioned brushing for a long duration of time is discouraged, highly discouraged. Sometimes people will say, my teeth has deposits, my teeth has color. Let me use hard toothbrush. Some toothbrush that we call, like, they usually call them smoker's brush, very hard ones. Yeah, let me use this hard toothbrush so that I'll be able to clean my teeth very well. In the process of using that very hard toothbrush, what it will result in is something like this that the picture is showing, where the gum has been worn off. So it's very highly advised. If you have, I have brownish deposits, I have yellowish deposits on my teeth, that no matter how I brush, they don't come off. It's better to there are ways that we can remove them in a short duration of time, and it's painless. You don't feel any pain, and before you know it, those deposits are gone. Instead of using a hard toothbrush, if you use a hard toothbrush, it will not remove those deposits, and it will cause more damage. It will cause damage to the gums. Another thing is we also have some toothpaste that I tag them highly abrasive toothpaste. So some toothpaste that when we take them, you see my like small dots inside, small sands on it inside the toothpaste. So those toothpaste that have very tiny hard things that are like sand inside, if we use them to brush, because of those hard substance inside the toothpaste, they can easily cause our gums to wear off. So that's the thing. It's a very important. So the way we brush, I would say, is one of the, like in the dental clinic where I work, majority of cases where we see something like this, that my gum on that side is wearing off, it is usually because of the way people brush. So if we can correct the way we brush, we've already taken care of the major cause of can we move to the next slide?
We're so sorry for the break in transmission. The network is very erratic at this end. So, Doctor, you can please go on. Can you see the slides? Hello, doctor. Dr. Ezekiel, I think we've lost him. Okay. While he tries to connect back, I would just take a rundown of how far he has gone. He's been talking about gingival recession. And he made us to understand that it's also referred to as receding gums. And this occurs when the gum tissue surrounding the teeth pulls back by exposing more of the tooth or exposing the roots that's inside the gum. And this can lead to several issues, which include tooth sensitivity and tooth decay and things like that. And he also talked about common causes. And part of the causes he said were poor oral hygiene through buildup of plaques. You know, when you don't brush your teeth very well, there are some white things that build up on the surface of the teeth. And this can irritate the gums and also cause them to recede. He also talked about aggressive toothbrushing. Like if you use so much force, so much energy to brush your teeth, or you use a very, very hard toothbrush to brush, it can wear out the gums. Okay, I think he's back. Dr. Ezekiel.
Yes, I'm back. I apologize for the network break in transmission.
Okay.
Okay, so can continue with our slides. Yes.
We're so sorry, we're having some slight technology issues. Can you see it now? Is she? We're so sorry, the network is erratic. I don't know what's happening at his end. But like I was saying, taking the rundown again, he talked about aggressive toothbrushing, brushing the teeth too hard, that it would cause a wear down on the gums. And he talked about gum diseases, which are caused by bacteria, which is a major cause of gum recession. Hello, doctor, are you back? Okay, so I think what we will just do while we are waiting for him. Dr. Nike Oduwole, good morning, ma. Please, can you unmute yourself, ma?
Good morning,
Good morning, ma.
everybody.
Yes, ma.
Good
Thank you
morning.
once again for joining. I don't know if you can give us one or two things about this particular topic, if it's not so new to you.
Unfortunately, I'm not a dental surgeon.
Oh, yes. Okay.
I'm a medical doctor,
Oh, all right, ma.
so I don't know. I don't think I'm really good at this, but I actually came to learn more.
Two. Yes.
We probably will wait for him. Thank you.
The network is very somehow this morning.
It's really bad. It's bad.
Yes, ma.
It's bad.
All right. Thank you very much, ma. Thank you.
Well done. Well done.
Yes, ma. Thank you, ma. Okay. So, from the little I know, because I'm not a dentist either, but from reading up on it, what I've learned about it is that people that smoke a lot or use tobacco, that chew tobacco, in those days, forefathers like taking tobacco when they go to the farm or when they are just relaxing in the house. They take tobacco a lot, and I'm sure some of us would have noticed that they have very brown teeth and their gums look like the pictures, like the figures that the doctor had shown us earlier. So smoking or chewing of tobacco can also damage the gums and contribute to the recession of the gums. Then genetics too. Some people are susceptible to gum recession due to their genetic makeup. They can inherit such a disease from their parents. And some people have lots of gaps in their teeth. So if they keep taking what's it called, tobacco or brushing hard, it would cause the gap to enlarge. Then biting, different shapes of teeth can also cause this. It's not everyone that has even set of teeth, so pressure on the gums can also lead to recession. While you're eating and you're biting into the gums, the force of the teeth into the gums can lead to recession. Then hormonal changes in people, particularly in women. When there's a hormonal change, it can make the gums to be more sensitive. Like when you take cold water or hot water, depending on the type of recession it is that your gums have. So cold or hot water, the intake becomes very sensitive to someone. Excuse me. The intake causes sensitivity in the gums. Hello, doctor. Are you back? Okay. I think he still has issues with the network at his end. Okay, I'm trying to get him now. Hello, doctor. Are you back? Okay, we have him back. We apologize for the break. So he's back. Doctor, over to you.
Okay. I apologize for the break in transmission. Can you all hear me?
Yes, we can hear you because they're meeting.
Okay. So as I said earlier, the way we brush is the number one primary reason. Another reason why we can have gingival recession is the way the gums are designed. We all even notice the way the gums are designed, there is a protein inside the gum called keratin. So that keratin helps to make the gum hard. So even if you are brushing with hard toothbrush or something, it will not easily wear off because of the presence of that keratin. But in some people, either they don't have enough keratin, or another occurrence is when the more we grow older, as we grow older, we get less of that keratin in our gums. So the older someone is, the more likely it is that I'm brushing, but my gum is wearing off. So it can also be age related. So that's why it's very important for middle age and elderly people to, this topic is very important to them because they are more at risk of this. It's natural. This one is natural. It's not that, oh, I did something, that's why my gum is peeling off. Or it's natural in the sense that the way we're designed naturally, the older we get, our gums become less stronger. And being in that stage, less tougher, it's more prone to wear. So another reason why we can have gingival recession to show here. It's not showing here. Why? Okay. Another reason why we can have that is, we call it traumatic bite or deep bite. There are some people that when they bite, their upper teeth is biting on the gum of the lower teeth. That is natural to them. That's how it is for them. So for people who do that, so this is what I was talking about, traumatic occlusion from deep bites. For people who bite, when they bite, their teeth does not meet early. It meets very late, or it does not meet at all. And they end up biting on top gum. For people like that, they are more at risk of this gingival recession, because just by natural talking and eating and doing everything, their teeth is already biting on the gum. Their teeth is already pushing the gum downwards. So that's a thing. Another cause of this gingival recession is there are some people, some of us sometimes, we just have this habit of, there is this pin. Let me just use it to poke my gum. It might be painful, you might see blood, but you just kind of enjoy it, just using paint to poke the gum, to just, so that's another thing that can cause the gums around that particular place to wear off. Another cause of gingival recession is improper use of toothpick That's why usually dentists just discourage patients from using toothpick, because most times we use it wrongly. Toothpicks are not meant to be used with the pointed tip facing the gum. They are not meant to be used with the pointed tip of the toothpick poking inside the gum, because doing that will cause damage to the gum. This picture I attached, the part that was pointed arrowish, for this particular patient, the patient has a habit of using toothpick in the guise of, oh, let me clean, there's food stuck there, and let me just use this toothpick to remove this food that is stuck there. In the process of doing that, you're poking your gum and causing damage to the gum. I also mentioned improper use of dental floss. Not everyone knows what a dental floss is, but I'll just say this. Our toothbrush are not designed to be able to brush in between two teeth. So when teeth are together and you are using your toothbrush to brush, it will not get in between. So that's where we have a dental floss. Dental floss is basically like a thread. Like a thread, we put it in between teeth and use it to remove whatever is stuck there. So that's it, basically. Is to clean tight spaces between two or more teeth. So there's a way you use the dental floss that it will end up causing more damage to your gums. So if you are in doubt, you are not sure, oh, I'm using toothpick, but I don't think I'm using it well, because anytime I use it, there's always blood coming out from that place. It's better, I would advise, come to a dentist to see us, and we'll give you a very good advice on how to go about it. Same thing as usage of dental floss. Not everyone uses a dental floss, but for those that uses it, it's better to use it in a good way so you don't end up causing damage to the gums. So another possible cause of this gingival recession is a fault of I can say is the fault of a dentist, basically, in this particular case. Because here we have a dentist designing something. Dentist has designed an appliance, and this appliance is what is causing the gum to go down, to push down. So looking at this, at the neck of the tooth, there's like a metal object on top of the gum. So this metal object resting on the gum will cause the gum to swell, will cause the gum to push down, to push downwards. We can't. Okay. We're working on ensuring that the slides starts to show up. Can we see the slide now?
I hope everyone can see the slides now. Okay. Okay, all right, go on, please. Yes, this one.
It's not.
Uh-oh. We're so sorry, the network again. Okay, doctor, I think you can go on now. Explain this. Something happened here. The screen sharing is paused. So we're trying to work on that, please. We are so sorry. Okay.
Okay. Okay. So welcome back. So as I mentioned, another possible cause of gingival recession is the fault of a dentist. So sometimes a dentist might design a denture, design a crown, design an appliance in the mouth, and this appliance that the dentist designed is what is causing the gingival recession. So yeah, sometimes it can be the fault of a dentist. So if you've been to a dentist, you've done a procedure, and you notice that since I went there and they did this, I've been noticing that this is my gum. I'm feeling pain, there's swelling around there. Come back and lay a complaint. So something will be done about it. So another reason for gingival recession, and this is more for generalized recession. Remember, I mentioned that generalized gingival recession is gingival recession that occurs when multiple teeth have recession, multiple gums are peeling off, multiple gums are shifting up or shifting down. So when it's generalized in that state, sometimes it can be caused by some diseases. Example of such disease is chronic periodontitis. So it might seem like a big word, but sometimes we look at some people's mouth and we see, you have a lot of yellowish deposits on your teeth. Those yellowish deposits are called calculus, and basically calculus on the teeth. So those deposits are able to cause the gums to wear off. Those yellowish deposits that you can see on some people's teeth, they have the ability to eat up the gums. So when they eat up the gums, you now see, my teeth is not looking the way it was looking before. You now have exposed roots because those debts on the tooth has eaten up the gums. So it's advisable that when you notice that, I have deposits on my teeth, I have yellowish deposits on my teeth, when I brush, it does not go off, you come to us or any dental clinic and ensure that it's removed to ensure that it does not result in something like this that is pictured, where the gums are eaten up and the roots are exposed. So we've been talking about, this is just a brief recap because of the breaks that we've been having. We are talking on gingival recession, and we've said that gingival recession is basically when gingiva is gone. Gingival recession is when the gums are peeling off. Either they are peeling off upwards or they are peeling off downwards, but the gums are peeling off. And we've talked about what would cause it. We've said, the way we brush is a major cause of gingival recession. So if you are using a hard toothbrush, we'll stop using it and then switch to a soft toothbrush or a medium soft toothbrush. But a hard toothbrush is highly, highly discouraged. It's not to be used for any reason at all. So we've talked about the causes. What causes it? We've said it could even be the fault of a dentist. We've said it could even be because of, I have deposits on my teeth that when I smile, I don't like the way it looks, and I've been brushing, but it's not going out. So how can I ensure that this thing does not? So we've gone through a good number of the causes. So now we've been saying, this thing is an issue, this thing is bad, but how does it affect us? How does it, I have deposits on my teeth. Okay, my gums, my roots, my gum is peeling off. How does it affect me? So the four main ways that it affects is, number one, we've mentioned that in gingival recession, the roots are exposed. And the way our teeth were designed, the roots were not meant to be exposed. Because we said initially that the teeth is divided into two parts, the crown, which we can see, and the roots, which is inside. The crown that we can see is stronger in the sense that if we eat and there's food stuck in it, we can remove it, we can brush it, and it will look good, it's shining, it's clean and all. But the root does not have, in our biology days, we did a bit of dental, and they said the crown of the tooth has different parts. There's enamel, there's dentine, there's pulp. So the enamel is the part that when I smile and, oh, I have white teeth, or if someone that has white teeth smiles, you see that, oh, this white part that you can see is the enamel. So the crown of the tooth has that white part, enamel. That enamel is very strong. It's even stronger than bone. So that's why you can use it to crack bone, you can brush it multiple times, and it's still looking as good as new. But the root does not have an enamel. So the root is not protected the way the crown is protected. So any case where you now have, oh, my roots are exposed, that root is more prone to diseases, to dental diseases. So you cannot have issues of, this is my root that was exposed, that was showing, my gum peeled off, my root is showing. I've been noticing that there's now hole in the root of my teeth. So the root of the teeth are more prone to holes. So yes, it might not be very common, but it's possible to have holes on the root. So another thing that can result in another effect of gingival recession is erosion. Erosion, we can say, just thinking about it, if there's erosion, if there's a road or there's a playground and there's erosion of that place, that means the sand that was on top of the field has been removed, maybe by water, by any reason. So when there's erosion around that place, it can cause sensitivity. So you notice that, since my root has started showing, I've been noticing that I have shocking sensation. A good number of us might be able to relate with it, where you notice that since for a while now, I notice that when I take cold water or when I even brush my teeth, I feel shock. It's like I will feel shock. The thing will even get to my head and stuff like that. So if the roots are exposed, is a very real possibility that the person will come down with, my teeth are shocking me. If I eat unripe pineapple, if I eat any unripe fruits, or if I take cold water or very sugary drinks, my teeth will be shocking me. So that's one of the effects of this gingival recession. The final effect of it that we'll talk about today is sometimes when we have this recession in between two teeth, it's difficult to clean. I mentioned before that the way our brush was designed, it was not designed to clean between two teeth. So if there is space between the roots of two teeth, it will be very difficult to clean. And if you cannot clean it very well, over time, you'll not be having holes on that root because there's difficulty with cleaning it. So we've talked about gingival recession. We've talked about what causes it. How does this thing even get to this stage? We've talked about the effect that, okay, how does this thing affect my life? How does it, like this thing that this doctor is just talking about, how would it really affect me? We've talked about that. So now we'll talk about prevention. There's no point in talking about a problem and not talking about how to prevent it, because it's highly preventable. It's something that if we follow the right steps, 99% or 95% we'll be able to prevent it. So prevention is very, very important. The first prevention that we'll talk about is brushing. Brushing twice daily, not 5 times daily, because some people eat multiple times a day, and in the guise of, oh, my mouth needs to be clean, I'm eating 5 times a day, I'm brushing 5 times a day. It is not ideal. Brush in the morning and in the evening or late at night before going to bed is the best way to go about it. To ensure, the reason why we are advocating for brushing twice daily is to ensure that those deposits, those calculus, those plaques that used to settle on the teeth and the gum that ends up eating up the gum does not stay. So if you brush regularly, you will not have that, you'll not be in that condition or situation where you now have a lot of those deposits, brownish, yellowish deposits on the teeth that ends up destroying our gums. The second way to prevent it is to floss daily. Sometimes some of us might have noticed that if I eat meat, if I eat beef, if I eat some kind of food, it gets stuck in between two teeth. And if I brushing does not remove it. So in states like that, if you use a dental floss will be able to remove food particles that is stuck in between two teeth. So to ensure that it's always clean, very important. Sometimes you can also make use of a mouthwash, antimicrobial mouthwash, but this is not indicated for everybody. It's not indicated for everybody. Another way to prevent is to follow the dentist recommendation for teeth cleaning. There is a thing that we call professional cleaning that is done in a dental clinic. Another name for it, or the main name for it, is scaling and polishing. So sometimes you stand in a mirror, you look at your teeth and you see that, I have deposits on my teeth too, and I've been brushing and they are not going off. If you come to a dentist, we'll do a professional cleaning and remove all those deposits on the teeth. And as I mentioned before, the procedure, some people are like scared of going to the dentist, that if I go now, the next thing they will say they want to remove my teeth. Removing a teeth is the last stage. There are a lot of things that we can do to ensure that it does not get to a stage where I'm feeling pain, or it does not get to a stage where they have to remove. So coming for cleaning, the recommended frequency is 2 times a year, every 6 months. So you come, we see you, remove any deposits on the teeth, and just to ensure that generally, as the person is growing older and older, all these teeth are intact in the mouth. It's possible to be 70, it's possible to be 80 and still have almost all the teeth intact, to be able to enjoy, eat chicken, eat rice, eat anything. So we just have to ensure that we follow simple instructions to ensure that our oral hygiene is always top notch. Another way, as I mentioned earlier, I initially mentioned that using hard toothbrush is one of the main reasons why we have gingival recession. It's one of the main things that destroys our gums, one of the main things that destroys our teeth. Some people will say, if I talk, my mouth, I feel like my mouth is smelly. I don't like the odor coming out from my mouth. So because of that, let me go and buy hard toothbrush. Let me brush my teeth very well so that my mouth will not be smelling again. In the process of doing that, we've seen a lot of people coming because of that reason, that my mouth is smelling, or my wife said my mouth is smelling. So because of that, I got hard toothbrush to brush to ensure that my mouth does not smell again. Doing that is one of the fastest ways to destroy the teeth and to destroy the gum. So it is not advisable. Like I said earlier, if you notice that, I don't like the color of my teeth, or I don't like the way my mouth smells, or a friend told me that when I talk, they don't like the odor coming out from my mouth. Instead of getting a hard toothbrush and brushing with force, instead of getting a toothbrush and brushing for 30 minutes, for 1 hour, come to a dentist. It is the fastest way to get a solution. Another way to prevent this condition is to avoid smoking or chewing tobacco. The main issue with smoking is that the nicotine in smoking tobacco affects the gums. So the gums are not able to heal well if there's any trauma, if there's any injury to the gums will just be having issues. It's not easy for it to heal well because this tobacco that is being smoked regularly affects the health of the gums. So advisable to just stay away from smoking. It is very important. So we've talked about the ways to prevent gingival recession. We'll now move on to the treatment. How do we treat this condition? So the main way for treating gingival recession, there are two ways, basically. We can do non-surgical. That means you don't necessarily have to do anything related to minor surgeries, or we might have to do something related to a minor surgery to ensure that this place that there was no gum before, the gum grows back or it is now healed. I mentioned ways to prevent. If, for example, you are someone that uses hard toothbrush, I notice that since I've been using this toothbrush, my gum has been peeling a bit. That it now looks as if my gum is eating inside. Usually, in most cases, if you stop using that hard toothbrush, you shift back to using a soft toothbrush or a medium soft or medium hard toothbrush, you notice that that gum that peeled off before will end up growing back a bit to resemble how it was, or even look the same way it looked before we started using that hard toothbrush. So the way we'll treat it, if you come to the dentist and you have this complaint, the way we'll treat it will depend on two things. The first thing is what caused this recession. That's the first thing that will determine how we'll treat it. The second thing is how bad is it? If you are asking what caused it, it's possible that this person is doing this thing, and the way to change the way to ensure that this thing does not happen again is to ensure that the person stops this thing that it's doing. Is to ensure that the person stops smoking, is to ensure that the person stops using hard toothbrush, is to ensure that the person stops poking their gum with sharp objects. So what caused the recession is very important, and how bad it is also very important. So in most cases, if the recession is not getting worse and worse and worse and worse, and it does not look very bad, it does not cause shocking sensation, it does not cause the person pain, usually we'll give instructions of, okay, this is how you brush. Brush well, brush like this, come for regular checkups, and in most cases, that will be enough. That will be enough. Another way to treat, as I said earlier, is to correct any bad thing that the person is doing. If you are using a hard toothbrush, you correct it, you don't use it. If you are using highly abrasive toothpaste, as I said earlier, highly abrasive toothpaste are toothpaste that when you check it, they have like things that look like small sands inside. So those toothpaste are highly abrasive. They can endanger the gums. They can cause damage to the gums. So another thing that can another way to treat this recession, so in some people's mouths, they have teeth that are not staying in place. Like the teeth are either inside or outside. They are not staying well. And usually when we have teeth that are not, we call it in dental, we just say is in the arc. When we have teeth that are not how they are supposed to be, they are either outside or they are inside. Those teeth are at risk of this gingival recession. So for that, we also have to come to a dentist to see and then ensure that proper treatment measures are taken. Another way to treat, especially for in people where it's like multiple teeth, when they smile, you can see that all your gums they are no longer in place. You're like, if I use pidgin, I'll say your gum don't chop. So when the person smiles, you see multiple front teeth, the gums are eating inside. So for those, we can fabricate something. That's what the slide is showing. Can fabricate that, and to just cover up the defects, cover up the gum, protect the roots that are inside to ensure that there's no pain, there's no sensitivity. Then the final treatment is more advanced, it's more of surgical. I apologize for this picture. I know some people might not really do too well with seeing blood and it feel like this, but it's important to just state that it is an option. It is an option, but it is the last option in the sense that we'll try the other treatment modalities first before this. Or when we check and we see that, this case is very severe, it's not something that if you just stop the habit, it will reverse. They might have to do surgeries. but they are not very major. So these are minor surgical procedures. It's something that you can do today, and tomorrow you are eating well. Tomorrow might be an overstatement, but you can do this, and a week later you are eating well, you are good. So in this small slide labeled A, you can see two teeth that the gums eat deep. So a surgery was done and the gum was moved up to cover it. Then if you look at the last slide, F, this is the same person, this is the same teeth, but the gum is now covering the tooth. So the roots are no longer exposed. So as I said, this is a more advanced way to manage this condition. So thank you for listening. I appreciate everyone for being with me today. Thank you.
Thank you very much, Doctor. We appreciate your presentation. I'm very sure many of us have not heard about this. It's quite an interesting, it was quite an interesting session. Now, because of time, I'll just take a very, very short recap of the presentation that he made. I apologize once again for the many breaking transmissions that we had. We are so sorry about that. Yeah, once again, the topic we had for today is gingival recession, which he said it's referred to as receding gums. You know, when your gums recede, when it goes back, and it's your teeth that we can see. And it exposes more of the tooth or its roots, which is not very good. And he talked about the common causes, which are poor oral hygiene, aggressive tooth brushing, gum diseases, which are caused by bacteria, could also be causes of gum recession. He talked about smoking, that we should stop smoking, stop taking lots of tobacco, and it could be genetical, and the way your teeth are placed, which this could be natural, the way your teeth are placed could cause recession. Hormonal changes too cause this, and we talked about the symptoms, which are your gums get red, they get swollen, and you could have bleeding gums in some cases. And he also talked about the treatment. We have to improve on our oral hygiene. If you've been using a hard bristled toothbrush, please change it to a more gentle, a softer toothbrush. And we can use dental floss to clean our teeth. You know, there are times meat or fish or some kinds of foods get lodged into your teeth, and it's not so easy to remove while brushing. So you can do dental flossing to remove the food or whatever it is that is stuck in your teeth. Then he talked about scaling and root planning, which is the procedure that you can use to remove the plaques that are on your teeth if you don't brush your teeth properly, that is. He also said that the last thing it is that you can do if all these treatments don't work, it's surgical, where tissue is taken from part of the mouth and used to cover the exposed roots and things like that. So to prevent further gum recession, the best thing to do is to have regular dental checkups, proper oral hygiene, and also address underlying causes, such as bite issues and things like that. And I'm very sure many of us know Bako. So I don't know, maybe we can even make use of that instead of, using hard brushes to brush our teeth and things like that. You know, Paco is natural, and all the bark of the Paco, I know it has some medicinal properties on it. So, you know, we can use Paco to clean our mouth, although most times they might not be very clean. So at least use Paco first off, then you can now use your soft brush to get the nice smell that you want. So, do we have any questions? You can raise your hands to ask your question or put your question in the chat box. Okay, there are some questions in the chat box. So, Dr. Ezekiel, I'm going to take some questions now. Someone asked, what is the major role of mouthwash in dental management, and which is preferable or better, alcohol-based or liquid-based? So can you please answer the question? Okay, let me just quickly unmute him. Hello, doctor. Yeah, the question once again, what is the major role of mouthwash in dental management, and which is preferable, alcohol-based or liquid-based?
Okay. Mouthwash is majorly because when we've been mentioning plaque, we're mentioning calculus, we're mentioning debts in our mouth, in our teeth. The major causes of these things are said to be bacteria, of bacterial origin. So it's the bacteria in the mouth that acts on the food that we eat that causes these deposits and yellowish discolorations on our teeth. So a good number of these mouthwashes are antibacterial or antimicrobial. So they have like some antibiotic components inside that ensures that they fight those harmful bacteria that are able to cause damage to our teeth, that are able to cause damage to our gums. So yes, mouthwashes can be used. Mouthwashes are indicated. Mouthwashes are important, and it does not really matter basically alcohol based or liquid based. The main aim is it has an antimicrobial component to it that is able to fight some of or most of the harmful bacteria that causes our gums to swell, that causes our gums to bleed, and stuff like that. So I hope I've been able to answer the question well enough.
Okay, thank you. There's another one. Can gargling with warm water and salt, can it be used for removing dirt in the gum? You know, when you gargle with warm water and salt.
Okay. You know, initially I mentioned something about when we brush, if the dirt is in between teeth, if it's lodged between teeth and inside the gum, brushing might be very difficult to remove such kind of dirt that are stuck. So gargling or flushing that side with water is very important. It's one of the most helpful ways because it's not every time that you even have access to floss. So sometimes you have water, you can just put water there and gargle that side vigorously. So as regards if you can use warm water and salt, the main indication for using warm water and salt is to help with inflammation. So in case your gums are swollen, you can use salt and warm water to bring down the swelling. But if it's just to remove dirt that is stuck in the gums, there's no bleeding, there's no swelling on the gums, you can use your normal water and you are good to go. They will do the same thing. They will do the same thing.
Okay. All right. Another question. What are the causes of cracking and peeling of the teeth, and how can we prevent it?
Okay. Initially in the lecture, I made mention of the crown. There's roots. The crown has enamel that is very hard. The root does not have enamel. So the root is more susceptible to damage. The root is more susceptible to bacteria and acid acting on it are causing issues. So if I said the crown, the enamel in the crown is very strong, it's even stronger than bone, why does it crack sometimes? Why does it peel? So it's a very reasonable question to ask. One of the main components of the enamel that makes it strong is the presence of fluoride in it. So if you have enough fluoride, if you are taking enough fluoride-rich drinks, fluoride you are brushing with, you must have heard about fluoride-containing toothpaste or something like that. Most of our toothpastes are fluoride-containing. So the purpose of that fluoride-containing, there's a whole lot of dental jargons, biohydroxyapatite and stuff like that. But the point is, if you are using a toothbrush that contains enough fluoride, it will go a long way in preventing cracking of teeth. So if you just notice that most of my teeth are just cracking on their own, like I'm not even eating so much bone, but they are just peeling off, they are just cracking, it might be issues with fluoride. In developed countries where they have central water system, where the same water is being given to everyone, it's not borehole system like here. Most of their water, they add fluoride to the water. So by the time the water gets to your house over there, you already have fluoride in the water. But here, it's not the case. Everyone provides their own water. So we don't have that level of fluoride in the water. That's why it's advised that we use fluoride-containing toothpaste to be able to bridge that gap. Thank you.
Okay, another one, is the use of cloves acceptable? I'm not sure acceptable for what, but the question is the use of cloves acceptable?
Okay, I'm not sure what is meant by cloves.
Cloves, those small herbs that look like how would I describe it now? Cloves. Okay, let's just go to the next question. What happened to teeth that always makes them yellow, whether we brush our teeth or not?
Okay. So I'll just say this now. The natural color of an adult teeth is not white. It is not. So if we look at a baby, look at their teeth, it's milkish. And you say, this teeth is whiter than the teeth of most adults, because that is how it is. The reason why our teeth are yellowish as we grow older, aside having deposits and stuff like that, compared to a baby teeth, is the presence of, I mentioned that the crown has enamel, it has dentine, it has pulp. That dentine, the middle layer of the crown of the tooth, is yellowish. So for an adult, the outer layer that we can see, the outer layer is more transparent. The enamel of an adult teeth is more transparent than the enamel of a baby teeth. So in an adult, the inside that is yellowish is more transparent. You can see inside more compared to when it's a baby. I don't know if I'm explaining this correctly or if I'm explaining it clearly for people to understand. But basically, an adult teeth is not meant to be white. It's not meant to be white. A bit of in between, I would not say full-blown yellow, but a bit of in between is normal. It's natural. So it's not the case of when I was a baby, I had white teeth. The color of milk teeth is not the same as permanent teeth. It's all natural. Thank you.
Okay, thank you for that. Another question, what's the best or most appropriate method to brush the teeth and the tongue? Because there have been different ways, like upwards and downwards and circular motion. So what's the best or the appropriate method to brush the teeth and the tongue?
Okay, thank you for this question. The way we are meant to brush, I mentioned initially that wrong toothbrushing is one of the main causes of gingival recession. So it is very important that we brush well to prevent it. The way I probably not say most, the way some people brush is to brush back and front. Like you are brushing your back teeth, your molars, back teeth. You are brushing back front. Brushing like that is exposing your gums to damage. So for those back teeth, you're supposed to brush up, down for those teeth. So depending on where you are brushing, that's what will determine the motion that you use. So it's not one motion for everywhere. For our back teeth, we are brushing up, down, up, down, up, down. The same for front teeth, up, down, up, down. Even inside, the part of the teeth that is like touching the tongue, the same thing. We brush up, down. But we are not brushing forward and backward. Brushing forward and backward, the only time that it's advisable to brush is if you notice when we bite, there is a part of our teeth that up and down are meeting, up and down are touching. So that is the only place that is advocated that we brush forward and backward, forward and backward. The part of our teeth that bite on top of each other. You can bite there forward and backward motion. There's no issue with that. There's no gum, so it's okay. You're not peeling off anything. You can brush like that. But for the other part, generally it's advocated that we brush up, down to remove whatever is stuck. And for brushing the tongue, also important that we brush our tongues. But be careful not to brush with too much force also, because that can also cause damage long term to the gum, to the tongue. So if you are brushing the tongue, we are brushing outward. We're brushing out. That's how we brush our tongues. Thank you.
Okay. Another question in the chat box. Please, how true is the statement that citrus fruit juice, like lime, can cause gradual erosion on the enamel? You know, taking lime or lemon, can it cause erosion on the enamel?
Okay, thank you. It is a very true statement. Citrus fruit or any fruit that is basically unripe can cause erosion because these fruits have a high acid content. They are acidic. So by the time you take them, you're taking acid. It might not be the kind of acid that will melt your skin or melt teeth or melt anything, but it's still acid. The pH of the fruit is showing that it's acid. Taking it over time will cause wearing, erosion. The enamel will be gradually wearing off, like scraping off with time. So imagine you are taking those acidic fruits like citrus fruit. It kind of softens the enamel of the tooth, and you now brush. So it's a very easy way to destroy the enamel. And over time, you now have episodes of, oh, I'm having shocking sensation, I'm having pain and stuff like that. So yes, it is true that citrus fruit juice and acidic unripe fruits can cause gradual erosion of the enamel.
All right, thank you. So our last question for today. In cases where a yellowish and smelling discharge occurs from the back of the tongue, is this healthy or is it a problem, and what's the solution? I don't know if you got that question.
Yes.
Okay.
If there's yellowish discharge from the back of the tongue, because you can't see inside your mouth, so it might not be easy to be able to tell with all certainty that this yellowish discharge is from my tongue. It might be from a decaying tooth, it might be from an abscess at a tooth at the back, so it could be from anywhere. So in cases like that, I would advise you come see a dentist. That's the best way to be able to see, to be able to examine, to be able to take a proper history, and to be able to tell you that, okay, this is the issue, this is what is going on. It's not something that can be diagnosed online like that, because you have to see, you have to examine, you have to be sure about what is going on before stating that, okay, this is the issue, this is how you can treat it and stuff like that. So it's easy. It's the best thing is just go over, see a dentist for proper diagnosis. Thank you.
Okay, thank you very much, Dr. Ezekiel. We really appreciate your presence this morning. Yeah, time is well spent. This is after 12. I thank everyone for their patience. And on this note, would anyone like to kindly appreciate the facilitator for today on behalf of everyone? Who would like to appreciate the doctor, please? Okay. I think I'm going to just call on somebody, if you don't mind. Okay, there's a hand up. At Mr. Dekunle Nuga.
Okay.
Thank you.
Good afternoon.
Good afternoon, sir.
Good afternoon. Thank you. On behalf of our HOS, on behalf of the permanent secretary, and on behalf of the PSD and the staff and our anchor person, and on behalf of the honorable participants, we say thank you so much, Dr. Ezekiel, for blessing us with the wisdom of God on how to take good care of ourselves and our dental system, what we used to call buccal cavity when we are studying biology. Thank you so much. We greatly appreciate you. And for your patience and doggedness in spite of the technical challenges over the air. We say thank you, and we pray that God will continue to increase your wisdom, your strength, and your ability to continue to be a blessing to humanity. And when next your assistance is needed, you will be readily available. Thank you so much, and God bless you.
Thank you very much, Sam.
Thank you, sir.
Thank you. Yes. So on this note, we've come to the end of today's session. We apologize once again for the technical issues that we had today. So in 2 weeks' time, by the grace of God, we'll have another interesting and exciting session. So I look forward to seeing everyone and much more people that would participate in this session. And as we usually do, we can all unmute ourselves and say hello to one another. Good morning, everyone.
Good afternoon, ma'am.
Good afternoon, sorry.
everybody.
Good afternoon.
Good afternoon.
Good afternoon.
Everybody.
afternoon.
Just to all your efforts.
Good afternoon, Madam Uduro
We
Dola.
appreciate
Good
you.
afternoon.
Good
Thank you
afternoon,
all.
everyone.
Bless
Mr.
you.
Nuga.
Thank
Good
you very
afternoon,
much
sir.
Thank you
Yeah,
very much.
Good afternoon, our great
for all the
presenter.
beautiful topics you usually bring to
Thank
help
you
us
very
as
much.
retirees.
Gbogbo yín máa
Good
fọwọ́ pa
afternoon.
ewu
Good
ẹ̀ ní
afternoon,
pa o.
everyone.
Amen.
Correcting that.
Ẹ̀yin náà
Sir.
dàgbà ẹ retire láyọ̀ o. We appreciate
Thank
you.
you.
Good
Thank
afternoon,
you.
all.
Thank you very much.
Thank you
Thank
very
you
much,
very
all.
much.
We want
Thank
our
you.
We
birthday gift
appreciate
this
you.
year. Saturday is my birthday. I will send somebody to come and collect my gift.
Okay, ma.
Biannual gift.
All right, ma. Thank you. We will do that. Noted.
God bless you, ma. Yes,
Yes,
ma.
ma.
Good afternoon,
Thank
all.
you.
Good afternoon.
Thank you.
Good afternoon. Good afternoon.
On behalf of Education District 2, we say thank you. Thank you, Education District retirees.
Yes, ma. You are most
Principals.
welcome.
Thank you.
Yes, ma. Thank you so much for attending.
That's all.
Okay, someone is asking for the doctor's contact.
Yes.
Yes. So I'll just call out the number.
Wow. Let me find the viral.
Doctor, are you still there? Locked out, so okay. So I'll read out the number now before we close.
Okay.
All right, ma'am. 0806
Mm-hmm.
838
Okay.
3919. I'll take it again. 0806 838 3919. And his name, once again, is Dr. Ezekiel.
Okay. We give him a call. He
All
can
right,
come
ma'am.
for visitation. Thank you very much.
All right, ma'am. You're most welcome, ma'am.
All
All right,
right,
everyone.
thank you.
Have a good day and a wonderful week. Stay blessed. Bye, everyone.
Bye. Thank you.
Bye.